When you first start, it's very difficult and it seems like nobody wants you to succeed. You know, you start with 0 followers and a big idea, which is what I started with. You hear all these horror stories of people posting something stupid and then losing their medical degree or getting kicked out of residency.
Ladies and gentlemen, welcome back to the MedFluencers Podcast. We have the one and only Dr. Goodman here with us today. Incredibly excited to talk with you, learn about how you got here. You're a resident still. You've grown a tremendous, dedicated following on social media. Dr. Goodman, please take it away. Let us know about yourself and how you got here.
Sure. Thanks for having me, Adam. I'm Jake Goodman. I am an upcoming third-year psychiatry resident. In about 7 days, I'll be entering my third year of residency. I'm also a mental health activist on social media. I've grown a following of about 2.1 million followers or so across 4 or 5 different social media platforms. I make mostly educational content, specifically in the mental health space, trying to teach people about what mental health conditions look like and what some treatment options are. And then also just let other people know that they're not alone in what they're going through, especially people in the healthcare field. I've been very active recently talking about some of the systemic issues that exist in medical school and residency and how many medical students and residents suffer from mental health conditions, why they suffer, and what some potential options are for changing the culture.
That's incredible. And there's a lot that we can dive into there. You know, one of my first questions that I like to ask is, how did you get here? It's a difficult road, especially as a medical student. And I felt some of that when I started on social media as a medical student, as a resident. What was that like for you getting to, because right now we're seeing the end, right? You've been on TV, nationally recognized, but what was it like on the way up?
That's a funny question, because when you first start, it's very difficult and it seems like nobody wants you to succeed. You know, you start with 0 followers and a big idea, which is what I started with. My idea was called Destination Med School. That was the name of the Instagram account. This was before TikTok even was a thing. My goal was to inspire future doctors and teach them all the things that I wish I knew, all the insight and guidance that I learned along my way. I wanted to pass on to them. I started with 3 followers, my mom, my dad, and my girlfriend at the time, who's now my wife, and built it really like a grassroots kind of movement. I was legitimately going up to people face to face and saying, hey, I've got this account. If you're interested or know anybody that's interested in medical school, please follow me. I was gaining one by one.
I love it, though. It's the story of every good entrepreneur, right? You believe in the idea, nobody else sees it. And I think we see that a lot with social media. There's just a lack of support. You start with an idea, people laugh you out of there. And what I see a lot of times in healthcare and specifically in academics is you shouldn't be on social media. You shouldn't be messing around with that. How has that been through residency? I mean, do people question your ability to be a doctor because you're on social media?
It's funny, when I first started, I didn't tell anybody I was doing it. I just did it. And people formed their own opinions about it. I didn't need anyone's permission to get started on social media. I just decided to do it.
Yeah.
And people were either supportive or not, or kind of not there at all, not supportive or not supportive, just didn't really acknowledge it. And that is what it is. It's fine. Over the years, as I've gone from medical student to resident doctor, that's kind of evolved. And I think I've actually gained more support. As a medical student, you're very much under the microscope. It feels like you're applying for residency. You're not a doctor yet. Feels like people are watching your every move. And I think once I got into residency, I received more of kind of like support from the general public. And yeah, it can be a scary road to travel because, you know, you're a doctor and you're supposed to make sure that you're talking about things that are medically, that are evidence-based.
Right.
And you hear all these horror stories of people posting something stupid and then losing their medical degree or getting kicked out of residency.
Right.
So it's been a journey, and I am not perfect. I've made mistakes and I've learned from them. And where I'm at now, I'm pretty comfortable in the lane that I'm in, and I've got supporters and haters, and it is what it is.
Well, you mentioned where you're at now. What does your audience consist of? Who are they, and why are they so loyal and dedicated to your message?
I think people resonate with me because I'm very open about what I've gone through as a human being. I've suffered from depression. I've experienced anxiety. I've sought treatment for depression. I went to therapy. still go to therapy.
Sure.
I started taking medication for my mental health. I still take medication for my mental health. I think many people resonate with that. I'm not just some doctor in a white coat in a, some high up position saying, you need to do this.
Right.
I've been through it. Everyone suffers differently. And by no means am I suggesting that what I suffer is the same as anybody else's, but I do know what it's like to be pretty depressed. I do know what it's like to sleep 3 hours a night or less. I know what it's like to feel no joy in what you're doing. And that makes me, I believe, a better doctor when I'm talking to my patients that are saying, I can't find joy in anything that I'm doing anymore. I know what that's like.
Right.
And I can kind of steer them in a direction of, hey, this is what the science shows. Therapy is really helpful. And for the right people, medication could be very helpful. But I've also been a patient myself.
Right.
I think people resonate with that.
Absolutely. And that's one of the things that we see on social media is this transparency and connection. You get to know someone. We say all the time, when I meet someone that I've never met in person from social media, I always feel like I've known them for years. Mm-hmm. And I remember you and I met at the White House a few years ago for the first time. It was like we'd known each other already. I mean, we hit it off right away because we're so transparent on social media that it's the same person. So you're getting a look into your life day after day. And I think the followers feel the same. They get to know you as a person and a physician.
Definitely. They're with you through the highs and the lows. And there's one example in particular that I really can think of. I got married about a little over a year ago. What is it? It's June right now. So a little over a year ago. And at my ceremony, I'm sure you probably saw the picture. As they were saying, you may now kiss the bride, as I'm leaning in for the kiss, my 2-year-old niece, who was the flower girl, lesson learned, never get your 2-year-old niece to be your flower girl, is walking to go back to her seat and trips over my foot in between my wife and I as we're getting the kiss, falls on the ground, starts screaming and crying. And I put that picture up. I said, you may now kiss the O-S-H-I-T, because that's literally what I yelled as she's falling. And they're with you through the highs and the lows. They're with you like, they want realness. And that's what really happened. I didn't have a fairy tale wedding.
Right.
I had to pick up my 2-year-old niece and run over to my sister as she's screaming and crying in front of 100 people.
Yeah.
And people resonate with that. And that's one of my favorite parts about social media. They're there for you in the lows and the highs, the funny moments and everything in between.
I think that's amazing. And it's a beautiful moment. I've seen the photo and it's amazing. But, it segues into, I think, why social media is so powerful. Like you said, the highs and the lows, the transparency, people know and trust you. Mm-hmm. And when it comes to delivering a message, what you say matters. And we all self-police and we kind of monitor each other to make sure we're kind of in our lane, so to speak. But I think you're right. The message from a healthcare provider on social media carries much more weight than a standard print message or some stock text out of a ad deck. I think what we do really matters, and we have the ability to really communicate both healthcare education and emerging technologies and therapies. And, in different spaces, we hear about it in oncology all the time that a patient will hear about a video from social media that ends up being a drug that changes their life. And it's amazing. And I think the same in psychiatry, that someone may hear a coping technique or have some idea of a new medication that they then go in and bring up to their doctor. Right. That starts a conversation. Have you had that experience at all?
Yes. I say this all the time, but if there are not psychiatrists or medical doctors in general on social media, that leaves a massive void for misinformation and for people to come in there and tell people what they should be doing with their bodies.
Right.
That's a problem. And we have an opportunity, especially I'll speak about in mental health. There's a lot of misinformation out there. Recently, for example, there was a post from actually Elon Musk, who, you can say good things about in the sense that he's a billionaire and, a business savvy person, but he is not a physician.
Of course.
And this is not a stance on Elon. I'm just pointing out a fact. He is not a physician.
Right.
And he recently, he's not a psychiatrist, and he recently put a tweet out about Wellbutrin, bupropion, saying how he's heard that everyone who uses Wellbutrin, I don't want to quote the tweet because I don't have it exactly, but it's filled with misinformation.
Right.
And it gets 2 million to 5 million views. And that really can affect somebody who might have been taking that medication and saying, Elon just tweeted about it. I'm not going to take this medication anymore.
Right.
Maybe they fall into a depressive episode and even worse.
Right.
One opportunity we have is to step in our lane and say, no, that's not right, Elon. Wellbutrin has risks and benefits, and here's what they are. And Jesse Gold, one of my friends who's here with us and MedFluencers, a psychiatrist, actually put a big piece out, I think in Forbes, about that specific tweet, and she had the opportunity to dispel that misinformation and talk about Wellbutrin and all the good and bad about the medication. So I hope that answers your question.
It absolutely does, and I think it leads into, some people say, why are physicians being compensated to talk about topics on social media, or they shouldn't be paid that much, they should. There's this back and forth, but the value that brings, that void, filling that voice, there's something valuable there, and it's difficult to assign a number to that, but it's something we need. I think we all recognize that, and it's time. And we could talk probably for a whole separate episode of the time it took to get where you are.
Thousands of hours,
tens
of thousands.
Right. You should start with 3.
Yep.
And the work that you put in to get here, to even have a chance to have a voice to combat the misinformation, that's valuable, and you deserve compensation for that work. And so that's something that we're really passionate about at MedFluencers, is supporting the creators who are out there doing this work. Because if you go to your academic institution, you go to your job, they laugh at this and they don't think that it's a good use of your time, and they're definitely not going to compensate you for it. But at the end of the day, when someone like Elon strikes out with a tweet like that, you want to be able to have a voice that's, other than that, we have the Surgeon General, and they're fantastic, but they're not going to go head to head with Elon Musk on Twitter. And we don't want to start battles, but it's nice to have a physician representative voice or a healthcare provider voice that is trusted, that can provide information. And I think there's real value in that.
Couldn't agree more.
Absolutely. So we could go on for a long time, but in the spirit of time today and your time, we'll keep it short. I like to ask everyone one parting question.
Okay.
Where do you see social media going? It's been a tremendous road to get here. It's been a tremendous road for you in particular. Where do we go next?
Man, I think about that all the time. I'll speak from a place of medicine. Where is social media and medicine going? And I think we're actually moving into this new frontier of doctors and other healthcare professionals starting to really embrace social media as a platform and a channel to educate people around the world. I just spoke at the American Psychiatric Association. I gave a 90-minute panel with 5 other psychiatry doctors who have large social media followings. I think between the 5 or 6 of us, we had over 5-6 million followers. Wow. And we spoke to 100+ psychiatrists at the American Psychiatric Association about why we should, as psychiatrists, use social media to educate and to educate our patients, because most of the people out there will never step foot in a psychiatric practice. Right. Most people will never for whatever reason, they don't have the funding. There's too much stigma there.
Sure.
But we can reach a 16-year-old in Nevada who lives in a rural town who may never hear about mental health education from a medical doctor. We can reach them with a TikTok video and teach them something that can save their life. And that's what it's all about. And I think medicine is moving in that direction slowly but surely. And, we are on the forefront of that. And I think over the next 5-10 years, and I hope, medical schools will start to embrace this. There'll be more education about how to create a message regarding a new update. For instance, 988, the new crisis hotline. How do you tell people about that in a way that they will watch it, save it to their phone, and have it for an emergency?
Exactly. It's what we're passionate about here is knowledge dissemination, knowledge translation, and getting it to people in those situations. So, Jake, I can't thank you enough for coming on. If you had any parting words or anything else you want to share, now's the time.
Sure. I always like to say this at the end of any sort of podcast or, episode. What you are going through now, whoever is listening to this, what you're going through now and the way you feel right now is not the way that you're going to feel forever. Sometimes you're at your lowest, but that is a moment in time. And in a few days, weeks, or months, you will no longer feel like that. It'll be behind you, and you'll live a much more balanced life. When we're really down and we're really feeling it, it can feel like that's the only way we're ever going to feel. But I promise you, I've been doing this for a little while. I've been talking to thousands of people that suffer from mental health conditions. What you're going through right now is temporary, and it will pass.
That's incredible. It truly gives me goosebumps between that and your last comment. Jake, really appreciate you coming on. Thank you to our listeners, and thank you again to Dr. Jake Goodman.
Thank you, Adam.
Thanks for listening to the MedFluencers Podcast. Be sure to subscribe and check out our other episodes on YouTube, Spotify, Google Podcast, Amazon, and more.